Thank you for having me here. My name is Dr. Jennifer Kelly, and I will be talking about psychology's role in achieving health equity. So, one of the things, the first thing to think about is that when you think about health, it's really more than just about health care. There are many factors associated with it: access to medications, prescriptions. We talk about the kind of treatment that you can receive, your access to insurance, disability, the type of coverage that you have, cost associated with it, safety. So all of these factors impact on health, and it's more than just about health care. The CDC defines health disparities as preventable differences in the burden of disease, injury, violence, or opportunities to achieve optimal health that are experienced by populations that are socially disadvantaged. And according to the WHO, extreme differences in health are significantly associated with social disadvantages. These differences are systematic, they are avoidable, they are facilitated and exacerbated by circumstances in which people live and they work, and they are intensified by political, economic, and or social influences. So when you think about health disparities, we know that it's a particular type of health difference that's closely linked to social, economic, and environmental disadvantage. And health disparities adversely affect groups of people who have systematically experienced greater obstacles to health based on numerous factors. Could be race or your ethnic group, your religious status, your socioeconomic status, your gender, your age, whether or not you have a disability, where you live, or other characteristics that are historically linked to discrimination or exclusion. What's intimately involved when you think about health disparities is the social determinants of health. And they are the conditions in which people are born, grow, live, work, and age. And they include factors such as the economic stability, the amount of money that you earn each year, where you live, the neighborhood, the physical environment. Do you have access to sidewalks, for example? Access to education, to healthy foods, the social support that you can get within your community, as well as access to health care. And we know that from that, we get the health outcomes, and those include mortality, morbidity, life expectancy, healthcare expenditures, the health status, as well as functional limitations. And we know that what goes throughout these, we see racism and discrimination. You really cannot deal with health disparities without looking at those factors. So this is some of the evidence that show you that health disparities really do exist. And these are global health disparities, and these are some of these as a snapshot. So as relates to age, people over the age of 60 have made up 94% of COVID-19 deaths in the European Union. We know that 2/3 of children under the age of 5 who suffer from stunted growth are from Africa and Southeast Asia. People in low-income countries have 18.1 years fewer, live 18.1 years fewer than those from high-income countries. And we know that African American babies are more than two times as likely to die as a child, as a baby, than other races and ethnicities. So you can see some of these global health disparities. So when you think about it overall, what we know is that globally, we know that there's been some positive trends as it relates to improvements in health. However, as you start looking at more detailed observations of it, what we see is that the persistence of health problems or diseases that should have been eradicated or controlled is not happening. And there's the emergence of unexpected health problems or diseases. And we also know that inequities in the level of health persist, and in many cases have increased between nations or regions within that same nation. So we do know that there's been some improvement, but we still have a good way to go. And according to the WHO statistics in 2020, what we found is that the income level of a country has a direct correlation with life expectancy. That makes sense. And the life expectancy of low income countries, as we mentioned earlier, 18 years lower than the high income countries, 18 years lower. And an estimated 1,800 million individuals worldwide are chronically hungry. And that's unacceptable. So insufficient access to safe and nutritious food exists despite the fact that the global food production is sufficient to cover 120% of global dietary needs. In 2018, an estimated 6.2 million children and adolescents under the age of 15 died, mostly from preventable diseases. And most of these diseases occurred, 5.3 million of them occurred in the first 5 years of their life, with almost half of these occurring during the first month of their life. So despite some of the progress, an increasing proportion of child deaths are in sub-Saharan Africa and Southern Asia. And 4 out of every 5 deaths of children under the age of 5 occur in these regions. And the children of sub-Saharan Africa are more than 15 times more likely to die before the age of 5 than children in high income countries. And 1 of 6 children in developing countries is underweight. And 1/3 of the deaths of children under 5 are attributed to malnutrition. So we know that that continues to remain a problem. And it's estimated that more than 5 million or 9% of deaths occurring globally are related to various forms of violence. And approximately 25% of these deaths result from suicide as well as homicide. So we see that violence is an impact as it relates to health disparities. And the types of violence vary in different regions of the world, but in general, their rates are much higher in poor and developing countries. And we also see that when you think about health inequities, the global concern look at as it relates to mental and behavioral disorders. In 1990, that accounted for 22% of the diseases that you see. And guess what? Fast forward to 2010, and it's 22.7%. So it continues to be a challenge on that global level, mental health disorders. And approximately 30% of the population worldwide is affected by some form of a mental disorder. And about 14% of the global disease burden is attributed to a neuropsychiatric disorder that includes depression, substance abuse, as well as psychosis. And we know that suicides account for about 1 million deaths annually. So one of the things that we're thinking about when you look at that is that this translated to hundreds of millions of people suffering from mental disorders globally. That includes depression, schizophrenia, alcohol use disorders. But more significant, over 2/3 of those affected do not receive the care that they need. And this is globally. So if you're going to really talk about health, you really must incorporate mental health as a key part of overall health. And so the application of the human rights and social justice frameworks and mental health require that there's a concerted effort and a commitment to address the underlying determinants of mental health problems, including the fair, the equitable, and ethical distribution of resources. And we know that if we had eliminated some of these disparities, I'm just looking at in the United States, how much money it could save. Billions of dollars annually. And a 2011 survey estimated that the economic cost of health disparities due to race in African Americans, Asian Americans, and the Latinx population from 2003 to 2006 was a little bit over $229 billion. And the Urban Institute calculated that the Medicare program would save $15.6 billion per year if health disparities were eliminated. And they looked at preventable diseases in the Latinx African American communities that include diabetes, high blood pressure, and stroke. So if you think about not just from the social justice or the ethical standpoint, it also makes sense financially to eliminate health disparities. And one of the things that we found is that health disparities have been heightened with the COVID-19 crisis. And in the United States, we know that COVID-19 has disproportionately impacted marginalized groups, such as Black and Indigenous populations, people with low income, older adults, and people with disabilities. It's been all over the news. And globally, COVID has disrupted or halted critical mental health services in 93% of countries. And we know that the demand for the treatment is just increasing. And we know that one of the things that we know that's been existing is the disparity as it relates to access to vaccines. So according to the head of the UN Health Agency, is the growing number between the number of those vaccines given in rich countries and those administered through COVAX is becoming more grotesque every day. And so we want COVAX really ensuring global equitable access to COVID-19 vaccines. And so it's not just in how much people are dying from this, how it's a disproportionate rate, but it's also who have access to the life-changing measures, and in this case, access to the vaccines. So while some countries are vaccinated, we could have access to the entire population of the United States if others would want to do it, and others do not have access to them. And the WHO chief says the inequitable distribution of vaccines is not just a moral outrage, it's also economically and epidemiologically self-defeating. And we know that some nations are vaccinating low-risk younger people at the cost of health workers, older people, and other high-risk, at-risk groups in other countries. So there's a lot of disparity with that. And we know that COVID-19 has had an impact on mental health. And you can see that during, we're talking about what occurred in 2020. So during late June of 2020, 40% of US adults reported struggling with mental health or substance abuse, 31% with anxiety and depression, 26% with trauma or stress-related disorder. Substance abuse started or increased 13%, and 11% seriously considered suicide. And Dr. Martin Luther King says that of all forms of discrimination and inequalities, injustice in health is the most shocking and inhuman. And we know that we have to do something about it. So what we want to do is to get to health equity. And it's the attainment of the highest level of health for all people. And achieving health equity requires that we value everyone equally with focused and ongoing societal efforts to address avoidable inequities, historical and contemporary injustices, and the elimination of health and healthcare disparities. So you could look at the left side and the right side. So equality does not mean equity. You have equality on the left side, but they can't all get to access to the fruit. On the other hand, you can see what happens when you give people what they need, when they need it, and the amount that they need it. And that's what health equity is. So I want to look at this medical model versus the socio-ecological model of health. And so if you think about the on the right hand side, there's the medical model. And it says that our health is really influenced by a combination of access to health care, genetics, and personal choices. This only makes up 30% of our health outcomes. Whereas when you think about this socio-ecological model, society, that's 70%. It lies within our social, political, and economic environments. And the systems, such as social compacts and the drivers of change, the social factors, the rules and practices that enact and promote the socio-ecological model determine the distribution of resources and opportunities and who has access to them. And I know that we, psychology, can play a role in achieving health equity. Environmental, social, and behavioral factors, all areas that of psychology's expertise they contribute to health disparities in interacting ways. And so we must position ourselves as a force for achieving health equity by finding ways to make concrete improvements in overall health of populations affected by the disparities. And so this is my presidential initiative, is our role, psychology's role in achieving health equity. And what I want us to do is look at science, policy, education, and practice. All of those are factors that's within our purview in terms of achieving health equity. So I have a presidential task force on psychology and health equity. And what we've done is we've put together members who have broad expertise in relevant areas, such as health disparities in working with Black, Indigenous, people of color populations, looking at the effects of built and social environment on health. And we have gathered together people who have know about psychological research on racism, public policy and advocacy, as well as practice. And so these are the members of our task force, the presidential task force on psychology and health equity. And the co-chairs are Dr. Jeffrey Reed, who's at Columbia University of Lagos College of Physicians and Surgeons, and Dr. Keisha Holden, who's at Morehouse Medical School. And these are the other people that are part of that. And so our goal is to articulate a vision for the role of psychology in advancing health equity. And we will be developing recommendations and innovative approaches for psychological science, education and training, psychological practice, public policy, and advocacy. And we will include recommendations for the corresponding APA organizational units. And we will also have a proposal that will be considered for APA policy at the next council meeting in October of this year. And these are some of the work products that we have. We've had one roundtable meeting, and we will have another one, summit meetings, and we get all of those who are invested parties, the stakeholders, and get them together and get the best thinking and how we can make a contribution to this. We have a special issue of the American Psychologist that will focus on this. And we've had APA convention programming, which I'll show you in a minute, and the recommendations for the policy development. You can still have access to this presidential programming until November, so it's not too late to register. And these are the presidential convention symposiums on psychology's role in achieving health equity. So one of the things that we know really in order to manage this from a big global perspective, we have to look at a population health approach. And you have the goal on the left hand side and the people on the right hand side. So the people who have a diagnosis, the one that have a significant mental health problem, you want to provide effective and efficient clinical care. So the ones that are more at risk, you want to mitigate the risk and provide early intervention. And you want to keep the ones that are healthy, healthy. So that is just kind of like the synopsis of, really simplified, of the population health approach. So to have a more equitable healthcare system, a mental health care system, we want to work more upstream than downstream. And we talk about working upstream versus downstream. So upstream, you have everyone in our communities should have these conditions: affordable housing, safe neighborhoods, fair standards of living. You don't have to deal with racism, a healthy environment. And you move on to midstream, there are good paying jobs, quality education, physical activity, and more downstream is incarceration, obesity, homelessness. And you're really acting at that time to change behaviors or conditions causing the stress or poor health. So more on the, you work more upstream, you need action at the societal level, and more downstream need action at individual and the family level. So you want to address the social determinants of health, where people work, where they live, where they grow. When we talked about that, access to healthy foods, the environments in which they live, embed services in the places where people go. You want to empower people to be healthy, activation. In addition to working with people who have a diagnosis, you want to work with those who are healthy. And also, we want to broaden the set of interventions that we use. And it's more than just sitting and doing one-on-one psychotherapy. We want to enlist others to build a broader mental health literacy, such as engaging community workers. And you want to focus on health at the community level. And finally you want to reframe how people view mental health, because that is something that's inside of all of us. And these are some of the resources that you can have access to as it relates to psychology's role in achieving health equity. And we know that we have to combine education, science, practice, and public interest. Unify all of these, united to benefit society and improve people's lives. Thank you.